In the shadow of a silent menace, the immediate dangers of radiation loom large, unseen, yet profoundly lethal. Such was the case following a catastrophic reactor explosion, where radiation became an invisible executioner, claiming lives and altering countless others forever. In the immediate aftermath of the explosion, 2 engineers lost their lives, and another 2 suffered severe burns. The chaos did not discriminate, hospitalizing 237 workers. Of these, 134 showed signs of acute radiation syndrome, a harrowing testament to the invisible dangers they faced. Among these, 28 would succumb within the first 3 months, their bodies overwhelmed by radiation's vicious assault. As the community slept, unaware of the disaster unfolding nearby, 2 fishermen experienced the harsh bite of radiation firsthand, suffering from nausea and intense vomiting after receiving estimated doses of 400 roentgens. Yet fate spared them, and they survived. The treatment of the most severe cases of acute radiation syndrome saw international collaboration, with American specialist Robert Peter Gale stepping in. Gale supervised groundbreaking treatment protocols, including bone marrow transplants, though these efforts met with limited success. Despite the grim circumstances, he later addressed misconceptions, clarifying that his patients posed no danger to visitors, countering a narrative that had veered away from the truth. The first responders, the station operators and firefighters bore the brunt of the tragedy. Over half of them continued to wear their uniforms, soaked with radioactive dust, leading to severe beta burns that covered large areas of their skin. In those critical early moments, the beta to gamma energy ratio spiked to 30:1, exacerbating their conditions. The extensive burns, coupled with the compromised gastrointestinal tract, created ripe conditions for bacterial infections, a deadly complication for those battling acute radiation syndrome. The treatment protocols emphasized stringent quarantine measures to shield the affected from further harm and prevent the spread of infections. Many of the surviving firefighters now live with lasting scars, their skin marked by atrophy and spider veins, a constant reminder of the ordeal they endured. As the years rolled on, the long-term impact of the disaster began to unfold. In the decade following the explosion, 14 more individuals, initially hospitalized, passed away due to various causes, with only 2 related to myelodysplastic syndrome. Despite fears of a significant increase in cancer among the rescue workers, studies coordinated by the Chernobyl Forum found no substantial rise in solid cancers, attributing observed increases in thyroid cancer to more thorough screenings rather than direct radiation effects. This tragic event underscores the pernicious nature of radiation and the imperative of robust safety protocols in nuclear environments. It serves as a stark reminder of the need for immediate and effective response measures following exposure, the importance of international cooperation in managing nuclear disasters, and the enduring impact of such events on human health and community well-being. In the realm of nuclear safety, vigilance and preparedness are not just options, they are necessities.
In the early morning hours of April 26, 1986, the Chernobyl nuclear power plant in Ukraine experienced a catastrophic explosion. This event not only changed the landscape of nuclear power, but also marked the beginning of a long-term health crisis for thousands of individuals across Eastern Europe. The Chernobyl disaster released large quantities of radioactive iodine into the atmosphere, contaminating vast areas of Belarus, Russia, and Ukraine. One of the most heartbreaking consequences of this contamination was the sharp rise in thyroid cancer among children living in these regions. By 2002, around 4,000 new cases were identified, primarily linked to the radioactive exposure from the disaster. Despite the grim diagnosis, the survival rate was remarkably high at approximately 99%, with only 15 terminal cases recorded at the time. While the physical health impacts are well documented, Chernobyl also had profound effects on mental health. The fear of radiation and its potential consequences led to widespread psychosomatic illnesses and post-traumatic stress. Many individuals, influenced by a limited understanding of radiation's effects and driven by fear, suffered from a sense of no control and adopted fatalistic attitudes. This often resulted in harmful behaviors and a reluctance to seek treatment for various diseases, believing them to be caused by radiation. Another interesting observation comes from examining the public announcements of contamination and the subsequent resettlement policies. Whether an area was officially declared contaminated, surprisingly, wasn't the best predictor of general health outcomes. Instead, resettlement status proved more crucial. Those who were evacuated and resettled often reported illnesses related to radiation more frequently than those who stayed behind, raising questions about the efficacy and psychological impact of resettlement strategies. By the year 2000, the number of Ukrainians identifying themselves as radiation sufferers and receiving state benefits had surged to 3.5 million. This designation provided access to state benefits and medical services, creating a strong incentive to be recognized as a sufferer. This, coupled with increased medical vigilance, meant that many benign cases that might have gone unnoticed in the past were now being treated and recorded. The toll on emergency workers was also significant. In Belarus, roughly 0.2% of the 66,000 emergency workers had died by the mid-90s. In Ukraine, a larger workforce saw 5,722 casualties among cleanup workers up to 1995, attributed to a range of causes not directly related to the accident. In conclusion, the Chernobyl disaster serves as a stark reminder of the complex interplay between environmental disasters and health. The physical impacts, such as thyroid cancer in children, are deeply intertwined with mental health issues and socio-political factors, illustrating the multifaceted nature of such catastrophes. The aftermath of Chernobyl continues to teach vital lessons about disaster response, medical preparedness, and the psychological impacts of environmental catastrophes.